Imagine this. You wake up in the middle of the night with sharp abdominal pain, appendicitis. They rush you to the nearest hospital, perform surgery, everything goes well. A month later, the bill arrives, $50,000. But you have insurance? Yes, but it turns out the surgeon is in your insurance network, while the anesthesiologist who put you to sleep on the operating table is not. You try to dispute the bill, you call the hospital. They say the anesthesiologist isn't their employee. You call the anesthesiologist. The secretary says he works for a company called Envision Healthcare. You Google the name and discover that behind this company stands an investment fund with $180 billion in capital. And suddenly you realize you've just become part of the largest financial experiment in history. An experiment where your health isn't the goal, but a tool for extracting profit. This is not fiction. This is happening right now to millions of people. Today we'll break down how investment funds turned healthcare into a money-making machine. How doctors became salespeople, hospitals became assets, and patients became revenue streams. And why people in Europe don't even understand what this is about. Stay until the end. There's a story so insane you want to believe it's real. Strategy. Number 1. Cutting staff. Doing more with fewer hands. The first thing new owners do is bring in consultants from McKinsey or Boston Consulting Group. These guys arrive with PowerPoint presentations and explain how to optimize operational efficiency. In practice, this means layoffs. Nurses. In a typical hospital before the purchase, one nurse cares for 4 or 5 patients. After optimization, 7 or 9. Studies show that when a nurse handles more patients, the number of medical errors, infections, and deaths increases. But on paper, payroll expenses dropped by 30%. Nurse Jennifer worked in a hospital in Ohio. After it was bought by a private equity fund, her workload doubled. She says, "Before, I could spend time with each patient, check how they were feeling, talk to families. Now I literally run between rooms. I don't have time to give medications on schedule. I forget to check vitals. I'm afraid that someone will die because I'm exhausted. And it's not my fault. There are just too few of us." Doctors and specialists. Experienced doctors with high salaries are replaced by young specialists or nurse practitioners. I'm not saying young doctors are bad. Many are great. But this is part of a cost-cutting strategy, not a quality-improving one. Technical staff, extra lab techs, technicians, and cleaners get fired. One cleaner must now clean not 10 rooms, but 20. Sanitary standards drop. Hospital-acquired infections rise. But expenses shrink. Strategy, number 2, explosive price increases. Make them pay. Now the most interesting part, prices. After a private equity fund buys a hospital, prices rise on average by 25 to 40% in the first 2 years. Let's look at a real example. A hospital in Tennessee charged $8,000 for a standard childbirth before being bought. But here's how pricing magic works. Complex procedures are broken into parts. Before MRI of the knee, Tragedies 1 service, $800 now. Pre-MRI consultation, pay $300. The MRI itself, about $100. Results analysis, $400. Post-MRI consultation, $350. Total, $2,250. Same procedure, new packaging. Additional fees. Mysterious items appear on bills. A facility fee, $500. Supply fee, $300. Administrative fee, $200. Documentation fee, $150. What are these? No one knows, but everyone pays. Emergency cases, the gold mine. When a person arrives by ambulance, they cannot negotiate. This is the perfect situation for maximum prices. Studies showed that emergency care bills increased by an average of 40% after hospitals were bought by private equity. Strategy number 3, surprise billing, the financial ambush. This is perhaps the most insidious scheme. It works like this. You carefully choose a hospital that is in your insurance network. You checked everything. Everything is correct. You go for surgery. After the surgery, you receive 4 separate bills. From the hospital, covered by insurance. From the surgeon, covered by insurance. From the anesthesiologist, not covered. He turns out to be out of network. From the surgeon's assistant, not covered. Also out of network. You didn't choose the anesthesiologist. You didn't even see him. You were unconscious while he worked. But now he demands $15,000 and your insurance refuses to pay. How is this possible? The hospital is in your network, but some doctors working inside that hospital belong to separate companies that deliberately stay out of all insurance networks. Why? Because that way they can set any prices they want. Many of these companies are owned, guess by whom? Private equity funds. Real story. Tina from Florida came to the hospital for a scheduled surgery. She checked. All right, the hospital and the surgeon were in her network. Insurance was supposed to cover everything except a $1,500 copay. The operation went well. A month later, the bills started coming. Hospital, $45,000, insurance paid. Surgeon, $8,000, insurance paid. Anesthesiologist, $12,000, not covered, she must pay. Surgical assistant, $6,000, not covered, she must pay. And pathologist, who examined the tissue, $4,000, not covered, she must pay total. Instead of $1,500, Tina owes $22,000 out of pocket. She didn't know these specialists were out of network. She couldn't choose them. But now she owes the money. She spent 2 years trying to dispute the bills. In the end, she filed for bankruptcy. Strategy number 4, pushing unnecessary services. Every patient must bring maximum revenue. After a private equity takeover, doctors receive quotas. Yes, actual quotas, like in a retail store. This quarter, each doctor must generate at least X dollars in revenue. How do they meet them? More tests came in with knee pain. Before, the doctor would examine it, maybe do an X-ray. Now, X-ray, MRI, CT scan, blood test, just in case, specialist consultation, physical therapy, 10 sessions. Do you need all that? Maybe not, but every procedure is money. More procedures. Dermatology became especially profitable after private equity entered. Funds massively bought dermatology practices. A study found something striking. After purchases, the number of biopsies, skin samples, increased by 50-70%. Did people suddenly get more skin cancer? No. Doctors were told, do more biopsies. Each biopsy, $300, $800. Most turn out unnecessary, but the money is already collected. Replacing cheap solutions with expensive ones. You have a simple infection. Before, $20 antibiotics, go home. Now, let's run an extended blood panel, $500. Check a culture, $300. Maybe you need an infectious disease consultation, $400. Strategy number 5, squeezing employees, maximum work, minimum pay. When private equity buys a medical facility, they freeze or cut wages. At the same time, they increase workload. The result, burnout and high staff turnover. Doctors become performers. Dr. James worked as a surgeon for 15 years. After his hospital was bought by a private equity fund, he says, now they tell me how many surgeries I must perform per week. I can't do fewer than 20. Before, I could give each patient as much time as needed. Now I'm on a conveyor belt. They gave me 45 minutes per surgery. If I'm late, a manager calls, asking why I didn't stay on schedule. They send me reports, how much revenue I generated for the hospital this month. If the number's low, they hint that other surgeons are more productive. I feel not like a doctor, but like a salesperson judged by revenue. It destroys the very essence of medicine. Nurses pushed to the limit, Samantha, an ICU nurse. I work 12-hour shifts. Before, I could take a break, have lunch. Now I often work without breaks. There are too few of us to let anyone step away. I make mistakes because I'm exhausted. Last week, I almost gave a patient the wrong dose of medication. I noticed only at the last second. I cry in my car after shifts. I love my job, but I can't do this anymore. Many coworkers left. Only those who can't find another job stay. Story 1. A young family and an unexpected birth. Alex and Maria were expecting their first child. Everything was prepared. The hospital was in their insurance network. The obstetrician gynecologist was in network too. And they had saved up $2,000 for the copay. Their budget was calculated down to the cent. The labor started 3 weeks early, at night. They were taken to the nearest hospital. Not the one they had planned, but it was an emergency. The hospital was in their network, so everything should have been fine. The baby was born healthy. They stayed in the hospital for 2 days. A month later, the bills arrived. Hospital, $45,000, covered by insurance. Obstetrician, $5,000, not covered, turned out to be out of network. Anesthesiologist, $8,000, not covered, out of network. Neonatologist, the doctor who examined the baby, $4,000, not covered, out of network. Emergency surcharge, $3,000, not covered. Total, $20,000 beyond what they had planned. Alex says, I called the insurance company every day. They said, these doctors are out of network, we don't pay. I called the doctors. They said they work with the hospital, take it up with them. I called the hospital. They said the doctors are independent contractors, take it up with them. I'm a software engineer. I make a decent salary, but $20,000 for one night? We took out a loan at 18% interest. Now we pay $500 a month for the next 5 years. That's $30,000 with interest for one night in the hospital. You know what hurts the most? We did everything right. We had insurance. We planned. But the system is built so that they'll strip you anyway. Story 2. An elderly woman and a nursing home. This one is especially grim. Private equity firms are actively buying nursing homes. It's a stable business, people pay monthly, and the money often comes from government programs. Margaret, 78, needed constant care after a stroke. Her daughter Linda found a good nursing home not far from her house. The ratings were good, the staff friendly, everything clean. Margaret moved in. The first 6 months were great. Then the nursing home was bought by a private equity fund. Linda says, the changes started gradually. First, they fired several nurses, said they were optimizing staff. Then I noticed that sometimes my mom was left in dirty clothes. The staff didn't have time to care for everyone. Then it got worse. The food deteriorated. Instead of normal meals, they served some frozen processed stuff. My mom began to lose weight. I complained. They said she was just being picky with food. One day I came to visit her and found her with a bed sore. That's when a sore forms on the skin from lying in one position for too long. It happens when bedridden patients are not properly cared for and not turned regularly. I made a scene. I moved my mom to another place. 6 months later, I read in the news that an inspection had found outrageous violations in that nursing home. Several residents had died from infections and inadequate care. You know how much the director of that nursing home chain made that year? $12 million while his patients lay in filth. Research confirms. After private equity funds buy nursing homes, mortality rises by 10%. The number of sanitation violations doubles. The number of nurses per patient drops by 25%. Profits increase by 30-40%. Story 3, an ER doctor in inhuman conditions. Dr. Robert had worked as an ER doctor for 12 years. He loved his job despite the stress. Then, the emergency department was bought by a company owned by a private equity fund. His story: before, during a shift, we had 5 doctors for 40-50 patients. After the purchase, they cut us down to 3. The workload became inhuman. During a 12-hour shift, I see 50-70 patients. That's 7-8 patients per hour. For each one, 8 to 10 minutes including the exam, reviewing the medical history, prescribing treatment, documenting everything. They sent me a productivity consultant. He sat with me for a shift and timed everything. Then he said, you spend too much time talking to patients, cut communication to the minimum, focus on procedures, they bring in money. I started receiving weekly reports showing how much revenue I generated for the company. If the number was low, my supervisor would talk to me. You know what they wanted? For me to order more tests, more CT scans and MRIs, more specialist consultations. A patient comes in with a broken arm. Before, I would examine, do an x-ray, put on a cast, send them home. 30 minutes of work. Now my consultant says, why didn't you order a CT scan? Why didn't you call an orthopedist for a consultation? Why didn't you run blood work to rule out infection? I say, because it's not needed. It's a simple fracture. He replies, the company expects $2,500 revenue from each ER patient. You're bringing in only $800. This is unacceptable. A year later, I quit. I couldn't do it anymore. I became a doctor to help people, not to milk them like cash cows. But you know what's the saddest part? A young doctor took my place, and he doesn't even know how it used to be. For him, this is normal. Now, the most interesting part. Let's compare how healthcare works in the States, where private equity rules everything, and in Europe, where healthcare is mostly public. Numbers that make your head spin. How much countries spend on healthcare? The States in 2023 spent $13,230 per person per year, more than any other wealthy country, by a margin of over $3,700. For comparison, Germany, $7,000. France, $5,500. The United Kingdom, $5,400. Sweden, $6,200. In 2024, the states spent around $14,885 per person on healthcare, the highest spending of any country. Wait, the states spend 2-3 times more? So Americans live longer and healthier? No. Life expectancy. The states, 77 years. Germany, 81. France, 82. Switzerland, 84. Japan, 85. The states spend twice as much money and get the worst result. How is that possible? Concrete examples, the same procedure. Let's compare prices for common medical services. Knee MRI. The states, $503,000. Germany, $300-$500. France, $200-$400. Childbirth, no complications. The states, $15,000 $30,000. Germany, free or symbolic $100, $200. France, free. The United Kingdom, free. Appendicitis, surgery plus recovery. The states, $15,000 $35,000. Germany, free. Sweden, free. Spain, free. Insulin, annual need for a diabetic. The states, $5,000 $10,000. Canada, $800 $200. Germany, free or $50 $100 copay. France, free. Ambulance. The states, $2,000 $5,000 per ride. Germany, free. France, free. The United Kingdom, free. Story of an average American versus an average German. Let us follow what happens to two people, John from Ohio and Hans from Munich, when they develop health problems. Scenario, both are diagnosed with type 2 diabetes. John, the States. Doctor visit for diagnosis, $250, $50 copay, the rest insurance. Blood tests, $800, $100 copay. Insulin, $400 per month, $200 after insurance. Test strips and glucometer, $150 per month. John's annual out-of-pocket expenses, $4,200. What insurance paid were $8,000. Total system cost, $12,200. 2 years later, John develops complications, foot problems, needs a specialist. Podiatrist visit, $350, $75 copay. And special shoes, $800, not covered. John begins skipping doctor visits and rationing insulin, cutting the dose in half. It's dangerous, but $200 a month is a lot for a family with 2 kids. Hans, Germany. Doctor visit, free. Tests, free. Insulin, $10 per month. 11 copay. Test strips free. Hans's annual expenses, $150. What insurance government paid? $3,500. Total system cost, $3,950. When Hans develops complications, specialist visit, free. Special shoes, $20, 22 copay. Hans continues receiving full treatment. He has no reason to save money by harming his health. 10-year result. John died at 62 from diabetes complications. His family was left with $85,000 in medical debt. They sold their house. Hans is alive and healthy at 68. Still working, playing with grandkids. No medical debt. The concept doesn't exist. Why is the European system cheaper and more effective? Government price regulation. In Europe, the government directly regulates prices for medicines and medical procedures. A pharmaceutical company cannot simply set any price it wants. It must justify it and negotiate with the state. Insulin example. This drug was invented 100 years ago. The patent expired long ago. Manufacturing a vial costs about $5. In Germany, it costs $30, $40. In the States, $300, $400. Why? Because in the States, pharma companies can charge whatever they want and insurers pay it. Nonprofit medicine. In Europe, hospitals are mostly state-owned or non-profit. Their goal is to treat people, not maximize profit. Doctors earn good salaries, but there's no crowd of executives with multi-million salaries and shareholders demanding 30% annual returns. Simpler administration? The states spend over $1,000 per person on administrative costs, roughly 5 times more than other wealthy countries. Why? In the states, hundreds of different insurance companies with different rules. Every hospital negotiates with dozens of insurers. An army of administrators handling billing and insurance disputes. Doctors spend hours filling out insurance forms. Patients receive dozens of bills from different providers. In Germany or France, 1 or 2 main insurance systems, standardized rates, minimal bureaucracy. Doctors treat patients instead of doing paperwork. Focus on prevention. The European system focuses on prevention and early diagnosis. That's cheaper than treating advanced disease. The state system is built around treatment, not prevention, because treatment brings more profit. Example. In Germany, every adult gets a free full checkup every 2 years. Early stage diabetes is cheap and easy to treat. In the States, many people skip preventive visits because they're expensive. They come only when the problem is serious. Treatment costs tens of times more. Monopsony versus free market. In Europe, the government is the almost sole buyer of healthcare services. This is called a monopsony. If a pharma company wants to sell a drug in Germany, it must negotiate with the German government. The government says, "We are willing to pay X dollar. Don't like it? Leave." The company agrees because the German market is big and losing it is stupid. In the States, each insurer negotiates separately. They have less leverage. Plus, pharma companies can sell directly to consumers through advertising, illegal in most countries. But isn't the quality better in the States? This is the main myth used by defenders of the American system. Yes, it's expensive, but the quality is the best. Let's look at the data. Maternal mortality, deaths per 100,000 births. The States, 1723, one of the worst among developed countries. Germany, 7. France, 8. Japan, 4. Infant mortality per 1,000 births. The States, 5.4. Germany, 3.3. France, 3.8. Japan, 1.9. Access to a doctor when needed. Over 25% of people in the States report skipping consultations, tests, treatment, or follow-up because of cost. 21% skip medication due to price. In Europe, these numbers are 2 to 3 times lower. Medical bankruptcy. The States, 530,000 people per year go bankrupt due to medical debt. Germany, France, Sweden, etc. The concept of medical bankruptcy basically does not exist. Real case comparison, same disease, 2 continents. David, 55, engineer from Texas, diagnosed with early-stage prostate cancer. Highly treatable if found early. Initial consultation and diagnostics, $8,500, $2,000 out of pocket. Surgery, $45,000, $8,000 out of pocket. Radiotherapy course, $35,000, $5,000 out of pocket. On follow-up plus medication, 2 years, $18,000, $6,000 out of pocket. David's total out of pocket, $21,000. He also took a loan against his house. He missed 3 months of work, partially paid. Result, cancer cured. David is alive but financially ruined. He sold his house, moved to a smaller apartment, retirement savings gone, works at 62, though he planned to retire. Marcus, 55, engineer from Munich, same disease, same stage. Initial consultation and diagnostics, $30 copay, $33. Surgery, free. Radiotherapy, free. Follow-up care plus medications, 2 years, $120 per year. Marcus's total expenses, $300 over 2 years. Result, cancer cured. Marcus is alive and financially stable. Retired at 63 as planned. Travels with his wife. Quality of treatment, almost identical. Prostate cancer survival in Germany is even slightly higher. Wait times, the only advantage of the States? Defenders of the American system often say, at least we have no waiting lines. Partly true, with nuance. Elective surgeries. In Europe, there can be queues for non-urgent elective surgeries, knee replacement, cataracts. Wait, 2-6 months. And in the States, if you have good insurance, you can do it quickly. If not, you may never do it. Emergency care. In both the States and Europe, emergencies are treated immediately. But in the States, ER wait times are often longer. Average 2 to 4 hours versus 1 to 2 hours in Europe. Access to a doctor. Europeans see doctors more often on average. Why? Because it's affordable and doesn't bankrupt you. Why can't private equity take over Europe? Simple answer, laws don't allow it. In most European countries, hospitals are mostly public or legally required to be non-profit. Doctors cannot own shares in hospitals where they work to avoid conflict of interest. Prices for medical services are strictly regulated. Profit from healthcare is legally limited. Some private equity funds tried entering European healthcare. Examples: buying private clinics in Germany, met heavy resistance and regulatory barriers. Attempts to enter the United Kingdom's NHS, political scandal and retreat. Nursing homes in Scandinavia. After several scandals over poor care, extremely strict regulations were introduced. Let's name names. Who stands behind the system? Private equity giants. 1. KKR, Kohlberg, Kravis Roberts. Manage over $500 billion in assets. Owned Envision Healthcare, the surprise billing scandal. Known for aggressive profit extraction tactics. Investors made billions while patients went bankrupt. Apollo Global Management. Own LifePoint Health and Scion Health. 235 plus hospitals. After their acquisitions, hospital prices rose on average by 30%. Founder Leon Black made billions. 3. Blackstone, the largest private equity fund in the world. Owned Team Health, emergency room doctors. After the takeover, emergency care bills skyrocketed. 4. Cerberus Capital Management. Specialize in distressed assets. Bought chains of nursing homes. Remember that study showing a 10% increase in mortality? Many of those homes belong to Cerberus top executives with astronomical salaries. HCA Healthcare, the largest for-profit hospital chain in the States. CEO Sam Hazen, $26 million per year, 2022. Meanwhile, his nurses earn $50,000 to $60,000 and are overworked. United Health Group, CEO Andrew Whitty, $20+ million per year. The company denies coverage for millions of claims. Company profit, $22 billion in 2023. Investors, the invisible beneficiaries. Behind the funds are pension funds, ironically, the money of ordinary people, university endowments, Harvard, Yale invest in private equity, wealthy families, sovereign funds of other countries. The irony, your retirement savings might be invested in a fund that will later hit you with a devastating medical bill. The army of middlemen between the patient and the doctor stands an entire industry. Insurance companies take huge commissions, PBMs, pharmacy benefit managers, intermediaries between pharmacies and insurers taking their cut. Billing companies specialize in maximizing bills. Consultants, McKinsey, BCG, teach hospitals how to squeeze more money. Debt collection agencies chase patients for unpaid bills. Everyone wants their share, and they all take it from your pocket. Key takeaways. This is not a broken system. It is a system functioning exactly as intended. Its goal is extracting maximum profit, not people's health. And in that sense, it works perfectly. Investors receive their 20-30% annual returns. The numbers don't lie. America, the richest country in the world, it spends more on healthcare than anyone else, yet its results are worse than in dozens of other countries. This is not a coincidence. This is a direct consequence of healthcare becoming a business. The European model has proven its effectiveness. This is not theory. This is a working reality in dozens of countries. People live longer, pay less, and do not go bankrupt. Yes, there are drawbacks, waiting times for non-critical procedures, but they are negligible compared to America's problems. Private equity is a catalyst, but not the only problem. Even without private equity, the American system was expensive and inefficient, but private equity pushed the problems to the point of absurdity. They took a bad system and made it even worse. A story that didn't make the news. A final story that shows the full absurdity of the situation. In 2019, in New York, a man almost died right on the street. He had a heart attack. The ambulance arrived after 15 minutes. But here is what witnesses said. When the ambulance arrived, the man, still conscious, begged them not to take him to the hospital. He repeated, "I can't afford it. I can't afford it." They took him anyway. At the hospital, they saved him. He survived. A month later, he received a bill for $57,000. His insurance covered $12,000. He owed $45,000. This man worked as a store manager. He earned $45,000 a year before taxes. The bill for his treatment was equal to his annual salary. He declared bankruptcy. Think about this. A person would rather die on the street than receive medical help because he knew he would not be able to pay for it. This is not a developing country. This is not a war zone. This is the richest country in the history of humanity. The final question. The next time you hear someone call European healthcare socialism and frighten people with government interference, ask yourself, what is worse? A government that regulates prices and makes healthcare accessible, or investment funds that earn billions because you got sick? What is more free? A system where you can receive treatment without worrying about bankruptcy, or a system where you pray not to get sick because it will ruin your family? The story of private equity in healthcare is a story about what happens when society forgets a simple truth. Some things should not be commodities. Education, safety, and yes, health. Because in the end, we are all human. We all get sick. We all grow old. And the question is not whether a medical problem will happen to you. The question is whether its treatment will bankrupt you. In Europe, the answer is no. In America, the answer is possibly yes, and the probability grows every year. This is not inevitability. This is a choice, a societal choice about what kind of society we want to build. Sources and additional information. For those who want to explore the topic further, An American Sickness by Elizabeth Rosenthal. Research by the Peterson KFF Health System Tracker. Work by Uwe Reinhardt on healthcare pricing. ProPublica investigations on private equity in medicine OECD health statistics. This story is based on real data, research, and documented cases. The numbers come from official sources, but behind the statistics are millions of real people with real stories.